doctor will instruct you to insert NGT or
We are
you
here
want
now
to
in
insert.
lecture.
So recent banding of the esophageal varices. When we say esophageal varices, it is just like a what do you call varicose veins. And your lower, there's also varicose vein in the esophagus. So they will just tie it, banding. We say banding, they will just, it is just like a, if there will be, for instance, if this is your esophagus, okay, and there are some of the various, like this, varicose vein. One of the surgery, they will put band in here. Okay, after they will bond, it's just like a surgery where they will insert something into the esophagus and they will clamp. After clamping, they will remove. So therefore, for some patients who undergo the surgery, NGT is not applicable. Anastomosis of the esophagus and the stomach. Blind nasogastric tube insertion has traditionally been contraindicated in some certain procedures involving this anastomosis because of the fear of damage to the staple line. Well, basically, when we say anastomosis, anastomosis means a removal of this specific organ. It is commonly observed for patients with cancer. Okay, a classic example, for instance, if this is your colon, your ascending colon, right? And this is your transverse colon. And this is your descending colon or sigmoid colon.
Pablooming
For
ba muli ay.
For instance, this is only a classic example. There is a tumor in the descending aspect of your large intestine. So therefore, one of the treatment for cancer is surgeries, aside from chemotherapy. So therefore, the doctor will remove a section of this area. What if this area is not being metastasized with cancer? One way for you is they will do colectomy. When we say colectomy, colectomy is the removal of the colon. Ectomy means removal, remember? So they will do colectomy when end-to-end anastomosis. So we say end-to-end anastomosis, after they will remove this portion who has cancer, well therefore they will connect it here on the sigmoid colon. That is what we call as the anastomosis. Meaning in Filipino, pinagdugso. Okay? After they remove, they will try to connect it again. This is called as anastomosis. Clear? Any more questions or clarifications?
Anastomosis.
Spelling. Anastomosis.
Eto, ma'am.
Anastomosis.
Okay. Really?
Rider. Si Rider. Bago lang.
This is the nasal
Hindi
gastro.
kilala.
No, naslimot ko.
Yung taba man ang naong niya.
Later on. This is a nasal gastro tube. This is a tube that is being inserted directly to your nasal cavity, down to your pharynx, to your nasopharynx, your oropharynx, your laryngopharynx, passes through your esophagus and directed into the
Stomach.
That's why it is called the
Nasogastric tube.
Up to your stomach.
Stomach.
Nasogastric tube. In some patients, or why it is being inserted for patients we have, why is that being directed into the oral cavity? Why?
Can swallow.
Huh?
Can swallow.
Ay, di ba? One of the indications for some patients, there are problem with the swallowing. So why is inserted into the nasal cavity? Good point. Good point of view. Why? It is not comfortable for you to be inserted in the nasal cavity. It's more comfortable for you to be inserted in the oral cavity. Why you didn't ask? Why you didn't? Why is directed to the nasal cavity? If I would be the patient, why you're not inserting into the oral cavity? Why you're inserting to the nasal cavity? Why?
Why, sir?
Why?
Why?
Why you didn't ask me?
Why?
Huh? I remember your patient now, so one of the indication is stroke patient, there will be a problem with their swallowing reflex or their deglution reflex. Why?
Because cannot swallow. No, cannot swallow.
But basically, you will also breathe in the nasal area. Why do you think so, Mary? Any idea why? It is more comfortable for you to be inserted in the oral cavity. Try.
Cannot swallow.
Tsaka
Cannot chew.
makakagat
Cannot.
yan eh.
Very good.
Oh, hindi makagat. Oh, cannot chew.
Di bite.
Cannot bite. Cannot
Very
bite.
good. Actually,
Can't
there are
bite.
two reasons why. Roida is correct and Hazel is correct because there are some patients who are also swallowing. If they will swallow it, of course, the NGT tube will be farther and farther and farther. Okay? For some patients, because there is not one of the indication. Another thing, some of the patients will bite. If you will bite this tube, well, of course, it will not be effective to your patient. Okay? It will damage the tube. Okay? But also, there are some patients who are inserted through the oral cavity or the OGT, especially for the unconscious patient or, what do you call this one, the intubated patient. Intubated patients, those are the patients who are connected to the mechanical ventilators. But of course, those are the comatose patients, remember? As I've said, the GCS scoring is already reviewed. So therefore, if their GCS is, if they are comatose, well basically they will not bite, they will not find also the swallowing reflex. So therefore, it is also safe for them to have this OGT. Are you clear? Are you understood? Good. Well, there are different types of the nasogastric shoulder. First, we have a common,
Types
this is
of
used in here in the hospital. We have the Levin catheter. This is single lumen, small bore nasal gastric tube that is more appropriate for administrations of medications or nutrition. There are various sizes. Of the nasal gastric tube depending on the patient's age or on the anatomical structures of your patient. Well, this is the French 16 nasogastric tube. It is usually used for patients who are adult. Okay? This is French 10. Yes, I'm right. This is French 10. It is written in here, French 10. It's the size. We say
The
French.
size,
That is the diameter. That is the diameter of the catheter. Okay, so it's more larger. This is a good example of the Levin catheter.
Levin
This is
catheter,
normally
which
you
a
can
single
also observe
woman,
this
small
to the
bore and
hospital,
tube.
right? Who will
This one.
undergo an internship? Have you experienced this one, the NGT?
Yeah.
For the long term
Yes.
care? How did you?
Yes, sir.
You also
Long time.
experience? Have you
Yeah.
experienced feeding your patient?
Yes, sir.
Have you experienced feeding
Yes,
your
sir.
patient? Very good, good. So,
Feed the medicine also.
Yes.
when giving medications also good. This is your Levin catheter. Have you asked? Have you asked? Simhar, what are you writing? We also have what we call as the Salem-Samp catheter. The Salem-Samp catheter in which this is a large bore tube with a double lumen catheter. This avails for aspiration in which the lumen and venting to
Salem-Samp
reduce
catheter.
negative pressure and preventing gastric mucosa from being drawn into the catheter. Well, basically, the Levin catheter is also one. Okay? But however, your Salem-Samp catheter, there are two ways. Okay, there are two ways. The other one, as I said, there are two purposes. We have the, what are the two purposes of NGT? We have the lavage and
Labas and labas.
gavage. Okay, when we say gavage,
Labas,
means
gabas. Inside,
go inside. We say lavage,
outside.
Okay,
Yes.
that's one of the purpose. This one is also for feeding, and like
Laban.
also check if there would be a purpose of aspirating the
Trabaho na
gastric
ninyo.
content.
Trabaho na
There are
ninyo.
types of feeding, as I said. One of the purpose of your NGT or your
Labas,
for the
labas,
nutrition of your
labas.
patient. Well, basically, these
Ensure.
are the different
Types of
foods
feeding. Yes,
or
types of
meals
feeding for
that you often
patient
observe in the hospital.
with this,
In the Philippines, of
gastric
course, we are a very
tube.
rich country. And you know very well.
Why she laugh?
Why? We're very rich.
Hello, bye. Don't forget to subscribe my YouTube channel, Henny's Family Vlog.
We only know and ensure that these are the milk that we are giving to our